Uh, welcome everyone. My name is Wesley Smith, and I have with me my colleague Karen King. And this was a podcast that we were going to launch in about a month and a half, right on the heels of the publication of our book. But we've decided that we needed to launch it now rather than later because of the announcement by the White House on Saturday that they were accelerating review of the use of psychedelics for various therapeutic interventions. And so this is going to be a bit rough because we haven't done any practicing on this, but we thought it was important because we're getting a lot of comments from conservatives. Some are excited, some are concerned. And we thought it would be a good time to address, as two conservatives, it would be a good time to address what the White House executive order means, what it doesn't mean, and use that as an introduction for our podcast. So here we are. Karen, you want to go ahead and just describe briefly your background, who you are, and then I'll do the same.
Sure. So I am a therapist. I've been a therapist for 20 years, and I am a MAPS trained psychedelic assisted therapist and MDMA assisted therapist. I also do ketamine assisted therapy for the past 6 years. And I was liberal until a few years ago when I had a psychedelic experience that turned me conservative. Wes, what
Okay,
about
that's
you? Who are you?
that's a very provocative intro. I don't have one quite as provocative. I'm a lifelong conservative, small C. I call myself a small C conservative. I try to avoid partisan politics as much as possible because I think there are many bigger, more interesting conservative issues to debate and discuss. But I come from a long line of warriors in my family. I was raised in the South. My father fought in World War II and the Korean War. In fact, you can see some of his memorabilia up there on my wall. I worked for the Heritage Foundation early on. I was a Reagan Republican and worked on a lot of issues that were kind of fundamentally have conservative roots. I worked on the States' Rights Project with then Governor Levitt of Utah, who had who was attempting a conference of the states it was essentially a federalism project. And I also worked with the Reagan administration in the Central America with the Contra War against the Sandinistas. And so I have fairly significant conservative bona fides. And I came into psychedelics about 3 years ago through a brain injury, a concussion that I suffered from a paragliding accident. So I am unlike Karen. I don't have a lot of letters after my name, just a JD, a lawyer. But I like to say I've been running from the law ever since I went to law school. But I do not have, I'm not in the therapeutic space. And one thing that you'll find if you follow this podcast is that Karen is very steeped in the therapeutic world with regard to psychedelics. I come at it more from a DIY, do it yourself, underground culture. And we'll be talking about the complementarity of those two cultures as well as some of the strains that exist between the therapeutic world and the informal underground world.
So, Wes, why don't you now take us into what happened on Saturday and what the executive order actually says about
Sure.
psychedelics?
Yeah, sure. So as with most things that come out of the White House these days, it's half entertainment, half substance. So we'll get to that in a moment. But on the substantive side, um, it was really quite groundbreaking because there have been discussions going on ever since RFK Jr. Became the head of HHS about how psychedelic usage for therapy could be facilitated more easily through the HHS process through the FDA. And so this executive
Yeah.
order essentially directs the FDA to fast track review of various projects that were already in the hopper with regard to psychedelic usage for therapeutic use, and specifically the treatment of PTSD, depression, and addiction. And it
Mm.
specifically identifies ibogaine, psilocybin, MDMA, and LSD. Cannabis, marijuana is on a different trajectory within the FDA, and of course, ketamine is already FDA approved for therapeutic use. And what the fast track does is essentially allow these 3 existing projects to get vouchers to eliminate a lot of the paperwork that tends to unnecessarily extend the certification process. So instead of certifications taking 2 years or 2.5 years, there's a good chance that some of these psychedelics will be approved for FDA use in therapy by the end of this year, or maybe even as early as the fall. It
Wow.
also directs the FDA and the DEA to create a pathway under the Right to Try Act. And this is critically
Yeah.
important. This allows eligible patients to access investigational psychedelics, which are these psychedelics, as part of their treatment.
Mhm.
And we can go back to why this Right to Try Act provision is so important. It allocates $50 million from existing funds for any state and private sector programs that are engaged in psychedelic use for clinical trials, and then it orders the HHS and the FDA to work with the VA to in the private sector to increase clinical trial participation. So those are the 4 main things that the executive order actually does.
Does it allocate $50 million just for ibogaine, or is it for the other psychedelics
It's my
considered breakthrough
understanding that
therapies as well?
it's for any of the
Okay.
programs that would meet the criteria, but
Okay.
I'm not
I didn't
real
realize
positive
that
about
because
that.
I know that ibogaine has not been really studied in a clinical setting in the US. And so, I think the question that people have a lot that I'm hearing is, so does this mean the drugs won't be safe if they're fast tracked? And actually, it's important to say that they have been studied, most of them, and the one that hasn't, ibogaine, is the one that I think is getting a lot of the funding for to start the studies because they've been observational and they've been happening outside the US until now.
Yeah, and it's interesting that you mentioned ibogaine because the Texas legislature authorized 50 million in ibogaine development and deployment in clinical trials
Yeah.
in Texas. That was almost entirely the result of efforts by former Governor Rick Perry. And he was noticeably absent at the White House ceremony,
Mhm.
which I don't want to
Mhm.
get into the politics of it because I'm not really sure why he was absent, but I'm guessing it had something to do
Mm.
with just the positioning of obviously the president there, and then all of his
Mhm.
supporters standing behind him, including such notables as Joe Rogan, the
Yeah.
head of HHS, the head of IHS,
Mhm.
and the head of the FDA. But it will be interesting to see whether it was specifically for ibogaine or the other psychedelics as well. I'm
Right.
not quite sure.
Well, and of course, from a therapist perspective, because I'm hearing from therapists that are now saying, how do I get the training for this? And so, we're in this unusual position where the executive order is to fast track these medicines that are already like MDMA in phase 3 trials and have gone through these review processes extensively. That therapists need the training. There are only a couple thousand of us, maybe, that have the official training that can do and have the certification so that we can do this work in clinical trials. So it'll be interesting to see, is the training going to be fast tracked as well? But that's like a whole other conversation.
Yeah, no, it's no,
um,
it's fascinating.
yeah.
It's what's interesting about our podcast is I'm thinking through the issues that we've already heard from conservatives about psychedelics. Is
Mhm.
that in a way, I think we need to back
Mm,
away from the executive order a bit and provide maybe a little bit more
mm,
context.
mm.
First, I think we ought to provide context of what the executive order is not. I think
Yeah.
out of the gates, it does not legalize psychedelic usage
Right.
across the board.
Yeah.
Um, it is the first step in what I hope will be a reversal of the
Mm,
1970s, of the provision in the 1970s Controlled Substances Act, which placed psychedelics as a Schedule One drug, meaning
yeah.
highly addictive, highly dangerous, with no therapeutic or medical benefit. And that was a political decision that was made in 1970. It wasn't
Mhm.
based on any science. And
Yeah.
this is, I think, is the first step towards saying we want to ultimately reverse that decision. And one way we're doing that is we're going to fast track FDA,
Yeah.
hopefully approval of certain psychedelic substances for therapy. And I think the idea is that that legislation in 1970 was based on political criteria, not scientific
Mhm.
criteria. And
Mhm.
um, we're now attempting a much more scientific approach to what these psychedelics are and aren't, and what benefits we might derive from them.
Yeah. Yeah, and in the training that I received from MAPS, which is the Multidisciplinary Association for Psychedelic Studies, just for anyone who doesn't know, and they have created the protocols and procedures in many of the clinical trials for these substances. That's why I keep referring to them. But in my training, it was very evident that it was a political decision and not a safety based decision because, as we're shown in all these clinical trials, the medications are very safe when used in structured and intentional and clinical settings, which kind of takes us to the next question that I've been hearing from people so much is, um, well, the main thing I hear from therapists, let's say conservative therapists, is are these drugs addictive? What does this mean that the executive order is saying, yes, psychedelics are valid tools, but aren't they really addictive? And of course, um, there's been so much research that says they are not addictive, especially the hallucinogenic psilocybin, LSD, MDMA are not addictive. And but I think that that's a real concern for conservative therapists because they work with addiction and they are the ones that are working with veterans that are coming back and dealing with PTSD and addiction. So they're very cautious. And I personally think that's wise to be really cautious around
Mhm.
these medications and medicines. You'll hear them referred to as medicines um, because they have so much power and there's so much transformative energy that they have in really helping treat intractable depression and PTSD. But I think it's a great question that people are skeptical and that they want to know if they're addictive or not. What are your thoughts on that, Wes?
Yeah, and it's both a simple response and a complicated one at the same time. I
Mm,
think that if
mm,
you're comparing psychedelics to other mind altering substances that are Schedule One substances like heroin,
mm.
cocaine, uh,
Yeah,
methamphetamines, um, they're relatively not only much safer but also much less addictive. And
yeah.
we'll throw up a chart here
Hmm.
uh, in the discussion notes about the what medicines and drugs are highly addictive and highly dangerous.
Yeah.
And you'll see that the psychedelic medicines are always on the
Hmm.
far end of the spectrum in terms of they're much safer and much less addictive. In fact, you could say psilocybin's not addictive at all.
Yeah.
There are some aspects of the use of cannabis that can be addictive, but even that type of addiction is not the same kind of addiction you would see from heroin or from cocaine or from methamphetamines.
Hmm.
But
Hmm.
in terms of danger, there is sufficient peer-reviewed literature as
Mm.
well as, and you can speak to that obviously better than I can, but as well as just now 40 years of underground
Mm.
experience of people using these medicines that really shows that they're not addictive. And if they're used in the proper setting, when you hear about these horror stories
Yeah.
of people going to raves and getting sick from the use of psychedelics, or ending up in the emergency room, it's almost entirely due to the lack of proper setting where those
Well,
medicines were
and
taken.
if I could like get dramatic around anything around this, is like the biggest thing that I want people to realize is that it is usually when you hear about a dangerous outcome or a bad outcome around these, it's usually because of the context. And if they are done with, and this is what our book talks about so much, is that if they are done with intention and setting and training, and there's follow up, all these stories that people come forward with, like I've heard that this person was out of their mind on psychedelics and did this terrible thing. It's like, well, anything used outside of its clinical formula or best use is, if you're on a really high dose in a really uncontrolled environment, who knows what things could happen. But if you're on um, a moderate dose on any of these medications and in a controlled intentional setting, my supposition is that these things would not happen. But people think the substance is bad versus looking at the context and what the dose was. There's a lot of nuance to that.
Well, and what's interesting about that comment is that most people think of drugs as independent of mindset or independent of intention.
Right.
And
Right.
I think it was Michael Pollan who mentioned in his book, he said, imagine psychedelics are like the placebo effect on steroids, which seems to be a bit of a contradiction because if you have the placebo effect, you don't really need the steroid. But I think what he was getting at was that these drugs, unlike drugs where you take a pill, you take a pill for hypertension. It doesn't matter
Mhm.
whether you have a certain mindset that day or you're in a bad mood. That drug should work for your
Yeah.
hypertension. But
Yeah.
these psychedelics, they can work in dramatically different ways depending on your mindset going into a
Yeah.
journey, as well as the setting around that journey. And
Yeah.
I mean, dramatically different outcomes. You can have
Yeah.
as I said,
Yeah.
most of the bad trips that you hear about
Yeah.
uh, are the result of not having had proper set. You didn't have the proper
Yeah.
mindset going into it,
Mhm.
and you weren't in the
Mhm.
proper setting, the environment in which you were
Yeah.
journeying or in which you were tripping. And so,
Yeah.
I think when you look at those experiences of people that had proper set and setting, the, the medicines can become very safe.
Yeah. Well, and
But
in
they're
my
but it
world.
is good to mention they're very
Mhm.
powerful. These are very
Yeah.
powerful
Yeah.
drugs. These are very powerful, in most cases, hallucinogens, although MDMA is, you don't hallucinate on MDMA, but, they're powerful medicines and they need to be respected.
Yeah, and it's so interesting to me the way they're entering the mainstream culture is through this clinical window, and
Mm,
President Trump and his team are really providing this pathway to conservatives and the population in general to see through the clinical doorway what this looks like. And then you have this wisdom of this other doorway that we'll be talking about more in our book and our podcast. But both of them really embody um, intention, mindset, and the practices afterwards that which really, really make a difference. Integration work. So when people think about psychedelic therapy, I think they think, "Oh, it's there's a therapist in the room and you're on this drug." And they don't realize that the therapist has seen the client, in my case, like 16 times and gotten to know them before
mm,
they do the psychedelic. And then they do the psychedelic and then they talk about it within a particular window for the neuroplasticity in the brain to take effect after the psychedelic, which we'll talk about more too. But
mhm.
I don't think people realize who don't know about psychedelic work just how many standards there are, even in the coaching world, that there is a container around it. It's not just one and done, or you're kind of left to just hallucinate as you are. You have a guide in there with you in both worlds, the DIY world and the clinical world. So I think that
Yeah, that's
helps
an
assuage
important.
people's fears.
Yeah, no, that's an
Mhm.
important point, because, when you mentioned also in the coaching,
Mm.
my wife does psychedelic assisted coaching,
Mhm.
and she's noticed, so we're, I and my wife are more in that DIY space. We're not
Yeah.
in the therapeutic space like you are. But it's interesting that there's a similar corollary or rather, there's a corollary to what you're saying in the DIY world, which is that you have people that use psychedelics in very unstructured settings or semi-structured settings, and the outcomes associated with those psychedelic experiences are significantly different than the psychedelic experiences associated with, for instance, when my wife does a coaching, psychedelic assisted coaching, she has several prep sessions and then
Mhm.
the journey and then multiple integration sessions, but it's
Yeah.
all within this framework of a coaching approach
Yeah.
where the intention is very specifically set. And then a lot of times, of course, psychedelics will provide insights that have nothing to do with your intention, and
Mhm.
then coaching
Mhm.
approach is to analyze and understand those insights.
Yeah.
There's a whole lot of noise which goes on in a psychedelic journey. It's kind of like a dream. Sometimes it's
Mm.
nonsense.
Mhm.
And
Mhm.
I think the job of a good therapist and a good coach is to separate all that noise from the signals, or
Yeah.
rather help the client separate all that noise from the
Yeah.
signals and help them understand what meaning they might be able to derive from those insights that they otherwise wouldn't have
Wouldn't have
understood or seen.
alone.
Yeah.
And this is a really good segue actually into why it matters that two conservatives are having this conversation, is
Mm.
that how the psychedelic world exists right now is very, very captured in the ideological left and that worldview. And so it's really important that you understand and have your values represented and respected when you're in the session. And that, is going to be harder to do when you're in such a specialized niche as psychedelic therapy. As a client, I think this is why conservatives need to be part of the conversation and have conservative therapists be in that vulnerable space with them. And we'll talk. I have so much to say about that. We'll talk more about that in
No,
further podcasts. But
and that's it's a great point you're
yeah,
making, kind of circling back to why this
hmm,
podcast and
yeah,
why are we getting so many questions from our colleagues, from our network?
yeah,
What does this mean? Who is this? What is this? Well, the
yeah,
reason is because most conservatives aren't involved in this
right.
movement, and the reason they're mostly not involved in this movement is because it started out as a left of center movement
Yeah,
back in the
yeah,
day, and that
hmm,
culture predominates. Whether it's a left of center uh, kind of, what I'll call the woo woo left of
mm,
center movement,
mm,
or whether
yeah,
it's a strict medical model,
hmm,
those two cultures, if you will, or mindsets are
hmm,
really not that relevant to the average conservative. And that's why I think most
yeah,
conservatives have looked at this, oh, this is a Burning Man kind of a
yeah,
thing. Psychedelics are for
hmm, hmm,
those people over there, not for me, not
yeah,
for the soccer moms, not for the average, American that goes about their day.
yeah,
And and I think that's been a great detriment to the movement, that we have not been
yeah,
involved in the movement more proactively
yeah,
because it's become captive by a left
yeah,
of center ideology, and the
hmm.
intent needs to be much broader than that.
Yeah, I mean, I think it's just a beautiful sort of paradoxical irony maybe, or maybe something that you and I both saw for a few years is knowing that the way it was gonna enter culture was through the Veterans Administration. And the traditional values of the veterans, it's just interesting to me that those are the people that are actually bringing it to the space and to the world. And yet they are the people that are feared or reviled the most by the left, the people that worship and revere psychedelic medications. And I'm thinking of the woo-woo crowd.
Yeah.
So it's
Yeah,
it's
it
an
has made,
interesting time.
yeah, no, absolutely. It's made interesting bedfellows within the psychedelic community, that
Mhm,
you have veterans, you have soldiers walking down the hallways of a MAPS conference, right next to people who are in drum circles, and
mhm,
uh, and people who are definitely pacifists. But
mhm,
the veterans have played an incredible role in
mhm.
legitimizing the use of these medicines for healing, and
Well, and
and
because they're suffering the most, I mean, and we put them in harm's way and they come back with these wounds, and that I think that's what's so touching about the way that this rolled out in the executive order is that it's because of the suffering that they are going through and the suicide crisis and the fact that we don't have interventions and medications that work as well as they need to. And that's why the urgency, and that's why pushing them through. I'm kind of jumping down our list. Wes and I have a list of what to talk about, but I think this circling back to the context of this is so important that it's the suffering that really brought this forward so fast. And also, there's a mental health crisis in our country, and there are lots of theories about why that is that we will talk about too later. But a lot of people are suffering, and veterans especially are having real struggles with addiction and suicide. So it's really important for them that this gets fast tracked.
all right, we'll go ahead and close out this. We'll go ahead and close out this episode, but we really do invite conservatives into this discussion. It's important that they have a larger role in the movement
Yeah.
generally, and specifically with regard to this executive order, but more generally, the reason that we're putting together this Substack and writing this book is that we need more conservatives in this movement. The tent
Yeah.
is too narrow, right? Is too the tent is too small, and we need to
Mhm.
broaden it. And so, please sign up for our Substack, and we'll be putting out a lot of content in the next month in preparation for our book publication, which we are planning will come out at the end of May, beginning of June. And so we hope you can join the conversation with us.
Thank you, and I would like to extend a special invitation to people like myself who moved from the left to what's considered the right now, and the formerly liberal and more conservative embracing values folks like me, and any psychedelic assisted therapist or therapists that are interested in doing this work and learning about it. So thank you. Please sign up for a Substack and you'll be hearing more from us.